responsiveness. You do that by simply, if you know their name, you can shout their name. But just tap the shoulders and shout, "Are you okay? Are you okay? Are you okay?" You next want to check for breathing. You do that by watching the rise and fall of the chest, or you can put your ear to their mouth to kind of listen for breathing. If you notice anything out of the norm, like gasping or wheezing or any other type of breathing, that is not normal. That's like one of the first signs of cardiac arrest. And you kind of automatically want to get started with CPR. And next you want to check for a pulse. With adults and children, you want to check their carotid pulse. This is the carotid pulse, the carotid artery. Okay, so they're not breathing, they're not responsive, they don't have a pulse. You next want to activate the emergency response system. You do that by having someone to call 911 and get an AED, or if you have your cell phone, you want to dial 911 and put it on speaker so that the dispatcher can kind of walk you through the steps and give you instructions until the rescue gets there. Okay, so doing compressions, you want to use the palm of your hand. Place it in the lower part of the sternum, the breastbone. Interlock with the other hand. And you're going to be hovering over the individual, but make sure that your elbows are locked in and your elbows are locked in and your arms are straight. And we're going to push into the chest 2 inches. Okay, and you're going to compress at a rate of about 100 to 120 compressions per minute. So, let's do 30 compressions. 1, 2, 3, 4, 5, 8, 9, 10, 11, 12, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 8, 9, 30. And also when you're doing compressions, you always want to remember to let the chest come back up and recoil. Let it always come back up to its normal position. What it does, it gets blood going back to the heart, to the chambers of the heart, and tries to get the heart back to filling again. So always, each time you compress, let the chest come back up to its normal position. Let it recoil. Compress, let it come back up to its normal position. Okay, so giving breaths. Due to COVID, we're not going to give the actual breath. We're just going to tilt the head back and say 2 breaths. But you're going to place your hand on the forehead, slightly pinch the nose, place 2 fingers on the bony part of the chin, tilt the head back, and give 2 breaths. You always want to tilt the head back when you're giving breaths. What it does, it opens the airway and it gets air into the lungs. That's what we want. We want the air to get into the lungs. And also when you're giving breaths, you want to watch for the chest to rise. That's how you know you're giving a faded breath. So when you don't open the airway, when you don't tilt the head back, they can aspirate. So you always, when you're giving breath, tilt the head back to open the airway. Any questions? Okay, I'm going to demonstrate this from the beginning. Okay, so I'm at the park, jogging at the park. I noticed that an elderly gentleman is on the ground. We're going to assess the scene, make sure it's safe to approach. Okay, it's safe to approach. Check for responsiveness, sir. Are you okay? Are you okay? Check for breathing. Check for a pulse. Okay, he's not breathing. He's not responsive. He doesn't have a pulse. Gonna activate the emergency response system. Call 911. Get an AED. Begin compressions. 1, 2. 19, 20, 1, 2, 4, 5, 6, 8, 9, 30. 2 breaths. 1, 2, 3, 4, 8, 9, 10, 11, 18, 19, 2, 3, 4, 5, 6, 8, 9, 30. 2 breaths. Any questions? Okay, let's have you all stand. We'll do a practice run. Okay. Okay, let's get a scenario here. You are walking downtown Jacksonville. It's getting ready to be a game. You're walking downtown, and you notice that a 45-year-old lady, she's collapsed to the ground. Apparently, she's had a heart attack or she's in cardiac arrest. Okay, let's assess the scene. Okay, safe to approach. Okay, let's approach the individual. Check for responsiveness.
Yeah, sir. Are you okay? Are you okay?
Okay, check for breathing. Check for a pulse. Okay, they're not responsive. They're not breathing. They don't have a pulse. Let's activate the emergency response system.
You go call 911 and got an
All right, let's begin compressions. Breaths. Okay. Okay, let's do 30 more compressions and 2 breaths. 15, 16, 17, 18, 19, 20, 2, 3, 4, 5, 6, 8, 30, 2 breaths.